your positive acknowledgement of our modest contributions as a state has gone a long way in helping us as a government, not only to be reassured about the steps we're taking in terms of reforms in the medical space in this state, but also, as you know, when you are undertaking changes, fundamental changes, the amount of resistance you meet sometimes can be quite discouraging. But when we hear voices like you who come up and speak up and say, you know what, you're on the right track, it's quite encouraging, and I want to thank you immensely for this support. Except, people like you lend a voice to the federal level, such that we decentralize the healthcare system in this country and strengthen it at its foundation, particularly the emphasis on primary healthcare. We will be just heading towards a catastrophe in the not too distant future, given what we're seeing with pandemics and epidemics across the world today. The foundations of our healthcare system in this country, particularly in the state, is just too weak. And it's not about infrastructure. It's not about the buildings. It's about the people. So one of the things we're doing in Edo State today is just beyond the governance, putting together a new agency, putting together new processes, procedures, ensuring that there's a scheme to pay for healthcare. We are now in the second phase of transforming the institutions that create the personnel to support our primary healthcare system. Just as we did with the School of Nursing, we are now restructuring our School of Medical Health Technology, because at that level we need to just create high quality, high performing people to manage the base of our healthcare system.